pain can be frustrating. It affects how you move, work, and even rest. But what if there was a method that doesn't just mask the pain, but actually helps you take control of it? At Sunrise Physical Therapy, we use the McKenzie Method, a series of targeted exercises designed to reduce pain, improve mobility, and prevent it from coming back. Today, I'll show you why it works and walk you through one simple exercise.
Why the McKenzie Method works.
The McKenzie Method isn't about endless stretches or random exercises. It's about finding the exact movement your body responds to best. It works by identifying the movement that eases your pain. It uses slow, repeated movements to help pull the pain back towards the center of your spine. If your pain has spread into your leg or arm, these movements aim to bring it out of those areas and back to your back, where it's easier for your body to heal. Once you know your movement pattern, you can stop a flare-up before it even begins. Signs this method might help you. You could be a great fit for the McKenzie Method if any of these sound like your back pain changes, getting better or worse, depending on how you move or sit. Sitting for long stretches, leaving you feeling stiff, especially during work hours. Pain sometimes shoots down your leg like sciatica, but eases off when you stand or shift position. You have rested, stretched, or tried the basics, yet the pain keeps coming back. If you're nodding along, this approach might just be the turning point your back has been waiting for. A simple McKenzie exercise, prone press-ups. Here's one of the most common McKenzie exercises for lower back pain. Prone press-ups. Lie face down on a firm surface, arms bent, hands under your shoulders. Gently press your upper body up using your arms, letting your hips and legs stay relaxed on the floor. Hold for 1 to 2 seconds, then slowly return to starting position. Repeat 10 times, moving slowly and without forcing the motion. You should feel a gentle stretch in your lower back, but no sharp pain. If pain centralizes and moves towards the spine, that's a good sign. It means the exercise is working.
Frequently asked questions. Understanding the McKenzie Method. How do I know if the McKenzie Method will work for my back pain?
If your pain changes with movement or position, getting better or worse, it's often a sign this method could help.
Will I have to do McKenzie exercises forever?
Not necessarily. Once you learn your go-to movement, you will use it mainly during flare-ups or as quick daily maintenance.
Can I still do the McKenzie exercises if I have a herniated disc?
Often, yes. Many people with disc issues benefit, but it's important to get guided by a physiotherapist first.
Do I need special equipment?
No. Most McKenzie exercises use just your body and a firm surface, making them easy to do anywhere.
What is a flare-up?
A flare-up is a temporary spike in symptoms like pain, stiffness, or discomfort, often triggered by certain movements, stress, or overuse. It's your body's way of saying something needs attention, not necessarily that the condition has worsened. The McKenzie Method puts you in control of your recovery. Instead of quick fixes that only masks the problem, it teaches you how to manage your pain and stop it from coming back. At Sunrise Physical Therapy, with the McKenzie approach, we help create the movement that works for you. If back pain is limiting your life, it's time to try a science-backed method with proven results. Visit Sunrise. No referral needed. Our contact details are in the description below. Let's get you moving freely again.